My name is Paul Campbell. I'm 52 years old and I was diagnosed in April 2019. When they told me I had prostate cancer, and then I said, okay, what are the options? They said they detected it early. So I was told at the time they thought the best thing to do was to have a prostatectomy, and if they removed the prostate, because of my age, because I was quite young to have, prostate cancer diagnosis. They said they thought that was the best treatment option. On the morning of the surgery, when I arrived at the hospital, got there at 7 a.m. in the morning. Loads of people were there queuing up, so I thought I was just one of many. I had a prop assessment again, blood tests, checked my weight, they checked my height, lots of repetitive questions about the process, and then I remember having an injection in my back, which was it seemed like an epidural, and I remember them telling me not to look at the needle, but I wanted to look at the needle. I was asking so many questions about what was happening. I just wanted to be informed about the procedures and the processes. And then they said to lie down and try to pick up my legs. And I thought, I can do this. I had 2 cannulas in my arm, and I just remember seeing everyone with masks on. And the next thing I woke up, I was in a recovery room. I was on my own. Didn't like the feeling of waking up and not having anyone around me. And then someone came and spoke to me, and I just was, I wanted to know when's the pain going to kick in. And I didn't have any pain at all, not at that time, whilst I was in the hospital. And I was discharged the following day. When I left hospital the next day, I was on crutches. I was more in discomfort than pain. I had the catheter in for 2 weeks. That was a really weird experience, wanting to go wee and just remembering I got this catheter and just seeing this bag just kind of, expand on my leg. It was just a surreal experience. And it was, the recovery was more about me being comfortable than being in pain. My recovery was, I think, around at least 4 to 6 weeks. I was off work for 2 months. In terms of other side effects at the time, there weren't really any. My side effects came much later when I had the radiotherapy, but from the prostatectomy, I was okay. After the prostatectomy, I think 3 months down the line, I had to go for a blood test. So my PSA was still high when I went there. And when I went back to get a second kind of PSA blood test, it was still rising, which indicated that the prostatectomy wasn't as successful as they had hoped. And I had to look at other treatment options, which was radiotherapy or hormone treatment. Again, they kind of suggested what they thought I should do, and that's when we went down the route of radiotherapy. I had 33 kind of treatments in the hospital. It was just a difficult time. I think being there Monday to Friday every day for it was 7 weeks, and everyone was really nice in the cancer center. But there were times you just didn't want to be there. In terms of this whole experience, that was the worst for me. Going to the cancer center, going for the procedures, and just being in that environment, knowing that everyone there is fighting a battle you know nothing about. The side effects of the radiotherapy, that was really hard. There was blood in my stools, my rectum was hurting on a regular basis, I had diarrhea. Sometimes I couldn't sit down straight. I didn't want to go to the toilet. I didn't want to do a number 2 because there was pain. And again, it was just part and parcel of the procedure. I was told that this was going to happen, but again, it was still difficult to prepare for that. They said this is going to work in conjunction with the radiotherapy, and the side effects of the medication was that I'd lose my sexual libido at the time. My libido was kind of 0, and that was the only kind of side effect I recalled from it. I'm not sure if it affected, my moods were affected anyway because of what had happened, but outside of losing my libido, I don't think there was any kind of side effect that I suffered. So the outcome of the radiotherapy and the hormone therapy was that the cancer was undetected, and I had to go back to get regular checks every 3 months to ascertain whether the cancer was still undetected or not. And it was, and then after every 3 months, they moved it to every 6 months, and then to every year. So I've been quite lucky since the radiotherapy finished. I've been undetected for the last year and a half, and hopefully that's going to continue.